Hi, everybody. Hope you're enjoying all the food and getting educated with all your doctors speaking and stuff. So we're going to talk about your neck cancer journey, how NCAN can help you, and how to advocate for yourself. So NCAN was formed 20 years ago. I was diagnosed 22 years ago. It'll be 23 years in February. And when I got diagnosed in 2001, there was no information out there. There was the Carcinoid Cancer Foundation that answered the phone Tuesday through Thursday, 10 to 4. Of course, when did I get diagnosed? 4 p.m. So I had to wait until Tuesday to speak to somebody. At the time of my diagnosis, I was given 5 years to live. And the first thing you do when you get home is to go on the internet. Well, that's a big mistake, because when you go on the internet, there's a lot of, especially in 2001, there was a lot of false information. And my children were young, and so I really felt the need that we need to get more education and awareness. We started raising funds for the Carcinoid Cancer Foundation, doing golf outings and things, but there was no awareness. There was no educational programs. And they were really focusing on research. There was no Zebra, there was no Neck Cancer Day or anything like that. And so Robin and I decided to form NCAN. At the time, it was the Carcinoid Cancer Awareness Network. And we wanted to grow awareness for patients, medical professionals, the general public, and we wanted to help patients and families navigate their journey. I know that when I got diagnosed, I was really scared. I was worried. I didn't know what was going on. A lot of doctors look at you and say, I don't know anything about this, but don't worry, you'll be fine. Or, oh my God, you're going to die tomorrow. So you never really got the real answers from them. So how does NCAN help you? We have a patient hotline. How many people have called the hotline? Okay. The hotline number rings on my cell phone 365 days a year. From 9 a.m. to 9 p.m., you can call and you will speak to me. If I don't answer the phone, leave a message. We are the only foundation in the neck community that answers the phone 365 days a year. Why I do it? I don't know. I guess I do it because I worry about people and I feel bad. I used to have carcinoid crisis always on Thanksgiving after eating turkey. And every time we would go to the hospital and they would say, gee, Maryann, you must have a kidney stone. And I'm like, gee, that's really weird that I only have kidney stones on Thanksgiving. So, I want people to be able to call me on Thanksgiving and Christmas and New Year's, because that's a very stressful time for a lot of people in the family. And stress brings out carcinoid syndrome. So that's why we answer the phone. We have a website. If you haven't been to the website, please go to the website. Sign up for a free information packet. It has all kinds of information in there. Come to the conferences. The conferences are the best way to learn how to be your best advocate. Sitting at the tables, talking to each other is the best thing you can do. Yes, we have podcasts and we have virtual meetings, but there's nothing like sitting in the room, sitting next to somebody that is going through the same journey as you. Even though, yes, we're all zebras and we're not exactly alike, but there's something about that feeling of knowing that there's a community behind you and that you're not fighting alone. We have support groups. We have about 30 of them across the country. Rhonda's not in here, but we do have one in Florida. I have two in Florida. And now that Dr. Chauhan is here in Miami, we're going to get the group up and running again. Because of COVID, we did stop all the support groups, but we're going to get it up and running again. So if you're interested in joining a support group, make sure that you send me an email at info@NetCancerAwareness and give me your name so I can forward on the information to Rhonda and we can get things going. We have awareness events. You all got a little paper in your bags, and in the bags is information about our virtual walk. This is where you can sign up and you get a t-shirt for $50 and you can walk anywhere in the country. We happen to have a walk usually in Long Island where we originated our organization, and we also have one November 4th in Charlotte. This helps make sure that these programs continue. Now, somebody just asked me earlier, Maryann, how do you do this at $20 a person? It's very difficult. Thank God for the sponsors who help us, but a lot comes from private donations and our fundraising events, such as the walk and our gala every year. So if you can attend an awareness event by signing up for a walk or a gala, that would be great. And we help you advocate for yourself and to get your best care. Now, I've talked to several of you, and I've connected several of you with the doctors today. And that's really, really important, and that's why we do what we do. We have people that are being treated by doctors that might not know 100% about the disease. So we try to connect you with the specialists that know about the disease and get you in the right direction, because we want you to live a long and healthy life and live the best life you can. So you have to advocate for yourself. Okay. So it was clear when I got diagnosed that NET patients really needed to be their own advocates, and we needed to know how to talk to doctors and how to get the information. These are some of our doctors here. Dr. Anthony must have left the room, but this is back in 2004, I think. 2004 with Dr. Anthony and Dr. Charlie Nunn. On the left-hand corner, upper corner, is Dr. Richard Warner. He was the founder of the Carcinoid Cancer Foundation. He has since retired. Dr. Odorizio is in the right-hand corner. Dr. Odorizio started with us in 2003. He was the first doctor to come to NCAN, and that's how the conferences started. We invited him out and said, could you come and speak to some patients? And he was like, absolutely. So Robin and I went over to the local Marriott hotel and rented a room, conference room. And then we're in the car, and I said to Robert, how are we going to pay for this? And he looked at me and he goes, I don't know. And I said, okay, well, let's hit up our friends and family. So we sat down and we had our first gala, which was back then called the dinner dance. And we had about 125 people. We raised $10,000 that night. The next day we had the conference with Dr. Odorizio, and the bill came out to $9,500. Perfect. Had $500 left, and that's how NCAN was formed. So, how to be your own advocate. This is practical advice. Keep networking. Now, I want you to say, whoever is sitting next to you, I want you to network. I want you to take a telephone number, so you become a support system, okay? Keep learning. We have conferences constantly all over the country. We have a podcast that's twice a month. We also do an online support group once a quarter where you can sign on, visit the website, you can get dates and stuff like that. Reach out to a NET specialist. And if you're not getting what you need from your doctor, meaning if your doctor isn't giving you the answers you need and not answering your questions, you need to leave. You need to find another doctor. I cannot honestly tell you how many doctors I have fired, because a lot of people, and especially the older generation, feel that they were brought up that the doctor knows best. Doctor knows everything. They're like God. But the fact of the matter is, this disease is very rare. And in medical school, they're only taught 15 minutes on neuroendocrine. 15 minutes. So there's no possible way they can understand this disease. So you need to make sure that you go to a doctor that knows what's going on. If your doctor doesn't belong to NANETS, the North American Neuroendocrine Tumor Society, everybody at Christmas time, you give a box of candy, you give a box of cookies, you give a box of whatever. Find out if your doctor is continuing his education. And by joining NANETS for them, I think it's like $100 or something like that for your doctor. They get all kinds of information. They can come to conferences. They get up-to-date information about the studies and things like that. That is a much better gift than giving a box of cookies, at least in my opinion. But a lot of doctors disagree with me, and I get in a lot of trouble. Okay. Well, nobody has to give you NANETS. You're in NANETS anyway. So NCAN is very busy. We do usually about five conferences a year. We do 3 walks. We do a gala. We do a podcast that usually Michael, my son back there, usually records twice a month. We do a virtual event, a question and answer monthly with the doctor. So right now, next Wednesday, we have Leanne Burns, who is a nutritionist, and we're going to have a question and answer period from 7 p.m. on Wednesday, the 18th. We're going to be putting that up on the website later on today. We have the virtual walk going from October 1st until December 31st, so you still have time to sign up. We have our walk on the 4th in Charlotte, and we have the Celebration of Life on Long Island, and then we have a patient conference in February in San Diego. Next year we will be in, confirmed is San Diego, Knoxville, NOLA, and Iowa City, and possibly 2 others, but I won't announce those yet. So that's the information that I wanted to let you know about. So what I need to know is how many people felt that this conference was very educational and that you would come back again and that you learned what you needed. That's what I like to see. So please remember that we are here for you. This is a family-oriented thing. There's a sign out there that says, every family has a story. Welcome to ours. By being here, I am welcoming you, not only to the NET community, I am welcoming you into the Wahmann family. We are here for you. We want the best for you. We want you all to have good lives. We want you on the right medications. We want you to get the right test. Make sure you go and speak to every one of these sponsors. They give us money, and a lot of pharmaceutical companies get a lot of bad rap. You know, they make too much money and this and that. Without the support of these pharmaceutical companies, this would not be possible. Would not be possible. So make sure you go and see them, talk to them, and thank them. If you see the doctors outside, please go over and thank them. They give up their time with their family to be here on a Saturday. Not many people would do that, give up. Some of them gave up on Friday to come here. So be grateful for that and thank them because it's very important. As many of you might not know, not only do I have this disease, but I have a daughter with it. So this is not only about me, and it's not only about my family. I'm looking at the generations behind us. When I started in 2001, there was 10 specialists in the whole world. 10 specialists. Just think about that. 50 states, and we had 10 specialists in the world. Right now, because of NANET and the work that NCAN has done, we now have hundreds of doctors. So let's keep that going. Support NCAN's events. Come, educate yourself, become aware of, spread awareness. In every one of your bags, you got a pin. It's a NET cancer pin. Wear the pin. People will stop and ask you, tell your story. There's an email, info@netcancerawareness.org or mike@netcancerawareness.org. If you're willing to share your story, give us a call. Michael will do a a podcast with you. Share your story, because by sharing your story, you never know who you're going to help in the end. You never know if that person sitting next to you in a restaurant or on the grocery line or somewhere else might hear you say something about neuroendocrine and say, hey, I know somebody. So please try to advocate for yourselves, advocate for others, spread the word about this disease. Let's try to find a cure. Let's try to, help each other out and be a true community, okay? So thank you for your time. I didn't go over my time, I don't think. And if you have any questions, please feel free to come outside and talk to me. I'll be here all afternoon. And I don't know who's coming up next. Oh, we have a big list. Robert will read it. So thank you again for everybody, and we'll see you later.